My name is Cindel Thompson. I am an LPN to BSN distance learning student at Indiana State University, and this is a presentation on colorectal cancer, the risks, signs and symptoms, and screening options. Please go ahead and pause the video to complete the pre and post test that's linked underneath this video in the description area so you can assess your current level of knowledge prior to proceeding with this presentation. Learning objectives. In this presentation, we'll learn about the risks associated with colon cancer, the signs and symptoms of colon cancer if they are present, and your screening options. Colorectal cancer is the second most common type of cancer and cause of cancer-related deaths in the United States. It's been responsible for an estimated 50,000 deaths in 2017. 1 in 21 men have a chance of contracting colorectal cancer in their lifetime. It's the third most frequent cancer among men. And 1 in 23 women have a risk of contracting colon cancer in their lifetime. And it is the second most frequent cancer in women. Risk factors. 50 to 75 years old. That age group is at a higher risk, although it has been seen in people younger than 50. Those who consume excessive amounts of alcohol can be at a higher risk of developing colon cancer. Consuming a high cholesterol diet. Smoking. Decrease in physical activity, so inactivity, not being physically active. Regular physical exercise cuts the risk of colon cancer by about 40%, according to some observational studies that have been done. Overweight and obesity increase the risk. This can be associated with that high cholesterol diet, the inactivity. Consuming processed meats. Having a family history of colon cancer increases your risk of developing it. So you want to make sure that if you have a family history, you are making sure you're doing your regular screenings. Any presence of ulcerative colitis or Crohn's disease. If you have either one of those, that increases your risk of developing colon cancer. If you have family members that have ulcerative colitis or Crohn's disease, you are at an increased risk of developing those diseases as well as colon cancer. So again, make sure you're doing your screening. And any sort of occupational exposure to asbestos can increase your risk. Signs and symptoms. A lot of people don't actually experience symptoms with colon cancer. Those that do will have a change in bowel habits. So any change in stool consistency, diarrhea, constipation, doesn't even have to be like a liquid diarrhea, just any change in the consistency of your bowels that is persistent, a persistent change, not you're constipated one day and then everything's fine for a week or 2 weeks or 3 weeks. That's not the change in bowel habits. Generally, the change in bowel habit is going to be something that's persistent, going on for long periods of time. Rectal bleeding or blood in your stool can also be a sign. Keep in mind that rectal bleeding or blood in your stool can be a result of hemorrhoids as well. So don't let it alarm you, but at the same time, make sure you pay attention to it and bring it to the attention of your healthcare team. Any persistent abdominal pain. Again, this is kind of a generalized symptom. People get this fairly regularly from gas pains or cramping. But if that pain persists for long periods of time, you definitely want to make sure you let your healthcare team know so they can investigate that pain. If you feel like your bowels aren't empty, so after you go have a bowel movement and you still feel like there's something there, that can be a sign. Excessive weakness or fatigue, also a sign or a symptom. And any unexplained weight loss. So large amounts of unexplained weight loss can also be a sign. Screening options. There are a lot of different screening options. I just chose the 4 that were the most common. Stool DNA test. This test uses DNA in your stool to detect abnormalities. The good thing about this test is you can collect it at home at your convenience, put it in the mail to send it to the lab. You also don't have to do any sort of bowel prep for this test. The downside to this test would be that it's less sensitive. If for whatever reason the test does come back positive, you will need additional tests. And also the test can produce a false positive, which means that the test comes back positive, but there's not actually anything wrong. And they will find that when they go to do the additional test. The fecal immunochemical test, or FIT test, detects hidden blood in your stool. Again, this is like the stool DNA test. You don't have to do any bowel prep, and you can collect it at home at your convenience and send it off or return it to the office. It doesn't detect all polyps and cancers. You may have to hold certain medications and avoid certain foods prior to doing your collection. Additional tests may also be needed if it's positive, and just like the stool DNA test, it can produce a false positive result. The third one is going to be a virtual colonoscopy, or a CT colonography. This is basically a CT scan of the colon to detect abnormalities. With this, it does not require any sedation or a scope being inserted into your rectum. It can require tubing being inserted to your rectum so that air can be used to inflate your colon so that they can see the colon better. It does require bowel prep, so you do need to make sure that your bowels are prepped and clean to help them visualize your colon better. The downside to this test is that it may not detect all small polyps and cancers. You may need to make some diet and medication changes prior to the test. It will expose you to radiation. And a follow-up colonoscopy may be needed if they find any abnormalities on the images. You can also develop some cramping and bloating from the air that's been used to inflate your colon during the test. And the last test is the colonoscopy. So the colonoscopy would be what is used for all of the previous tests if they show anything on them. So if your DNA test, your FIT test, if either one of those come back positive, the colonoscopy is going to be the next test that they choose to do. The virtual colonoscopy, if they see anything abnormal on those images, they're going to refer you to do a colonoscopy. In a colonoscopy, a scope is inserted into the rectum to see the colon. It can see the entire colon. The test takes 30 to 60 minutes. If there are any abnormalities, the plus side of the colonoscopy is there is no return. You don't have to go back and do another test like you do with the other ones. The other ones you follow up with a colonoscopy. If you're in for a colonoscopy and they find anything abnormal, a polyp, any abnormal tissue, they can remove the polyps, biopsy the tissue while they're in there, so you do not have to go back for a second trip. It is the most sensitive test. The downside is that there is bowel prep required. This means that you will be restricted on the types of things you can eat. You'll also have to drink a significant amount of fluid, take some laxatives, do enemas, things of that nature. It's a pretty involved bowel prep process. It's probably the most uncomfortable portion of this test is going to be the bowel prep. That's the one that people complain about the most. The test itself is performed under sedation, so you need to make sure you have someone to drive you to and from your test. You can have bleeding from the biopsy site, so you'll be directed on how to pay attention to the type of blood if you have any blood coming out of your rectum. You can also experience cramping or bloating from the scope that's been inserted into your rectum. Please complete the pre and post test again that's linked under the video in the description area to assess your level of knowledge upon completion of this presentation. There is also a brochure that accompanies this video. It's attached under the pre and post test in the description area as well. Thank you for your time.